Hi, everyone. I'm Anna Lepevic, one of the co-founders for Push, and I'm so happy and excited today. We have a special guest coming to us from the TikTok world, thanks to one of our change makers who saw her video and was really into it and shared it with all of us. And we were like, yes, we need to have her on because these are topics that don't get discussed enough. Both of them that we're speaking about today, we will be talking about stillbirth, and unfortunately we have experienced stillbirth ourselves here at Push, all the founders, so we try to talk about prevention, but this conversation is about after stillbirth and what you should have done, which will also lead into the conversation of pregnancy after loss care in case you do decide to have another baby. That will definitely inform the type of care you should have. So thank you so much, Emmie, for joining us. Why don't you introduce yourself real quick to our audience, and then we'll get into this great conversation.
Yeah, thank you so much. And thanks so much to Push for inviting me on here. I'm Dr. Emmie Strassberg. I'm a maternal fetal medicine physician, and I currently run a preconception counseling telemedicine practice where I help women plan their next healthiest pregnancy. And I have a particular space in my heart for women who have experienced pregnancy loss. And I also am running a membership called Building Hope After Loss to support women who are planning pregnancy after loss.
Awesome. Thank you so much. So this is a good question just to get us started. What kind of brought you to this expertise? I'll say it's an area I think that not every doctor even gets trained on, especially the post-stillbirth, what you were talking about in your TikTok video, which we can talk about in a minute here. And also just taking care of the PAL patient, which is a high needs group. You know, it's definitely a different type of pregnancy. We're very high risk a lot of times. A lot of those unknowns that come from the loss kind of trail into the next pregnancy. And we also obviously have special needs, emotional support needs, and those type of needs. So what is it that kind of drew you to that?
Yeah, I think one of the big things that drew me to maternal fetal medicine in general is growing up, my mother has lupus. She's actually doing much better now than she has at other times, but she had very difficult pregnancies and experienced pregnancy loss. And growing up and hearing her stories about what she had to deal with the healthcare system going through that just really prompted me to want to be able to be the kind of doctor who could give somebody like my mother good care. Yeah, so I have not experienced loss myself, but my mom's story sits with me very strongly. And in my career in maternal fetal medicine, it always surprised me how often I would get a patient with a history of pregnancy loss and how little information I had about that, or they had about that. Even if I could obtain records, often no autopsy was done, no genetic testing was done, very little workup was done. And then here we are at the next pregnancy and we haven't really figured anything out yet. And so I really think this is an area that we can get so much better at, like many areas of women's health. But I think this is one where we need more research and we need more information. We need more people championing this particular area of women's health because it's 2026 and we should have better answers than we do.
Yeah, absolutely. Well, 1 in 4 experience a pregnancy loss of some sort. And we know that 1 out of 170 or more now are having stillbirth. So it is very common and it is something that we do feel should have specialized care. So why don't we talk a little bit about what was in that TikTok video that kind of got our attention, because it is something that we do feel that not every parent gets. So after a stillbirth, what type of evaluation do you normally want to see done for the family so that you can have these answers and this information moving forward? And for closure, of course, too, we want to know why our babies died.
Yeah, so one of the things that really struck me as I was going over some literature from the Society of Maternal Fetal Medicine, they have a checklist for post-stillbirth. And one of the biggest things on there is this post-stillbirth autopsy. And then very importantly, if autopsy is declined, offering at least an external examination, maybe some x-rays and MRI, some other evaluation so that we can get some more information. And this is, I mean, I've almost never seen that done. And that really struck me, that I've not seen that done. When I was in residency, we had a good loss program. It was run by some amazing labor and delivery nurses. And they would do an external examination and evaluation of all stillbirth babies. But I hadn't seen that ever since I left that hospital.
Mm-hmm. Yeah, personally, we were actually talked out of an autopsy by the doctor that was involved with the resuscitation of our son because, it was so shocking. Obviously, we're in trauma. We just found out our baby died. And then immediately after, having a conversation with the person that we felt failed in the resuscitation. So we weren't very happy, to begin with this person. And she comes in to describe it to us and say, a lot of times we don't find answers. A lot of parents kind of feel bad that they did it and they didn't really get what they wanted out of it. And they had to spend money because sometimes insurance won't cover it. And she kind of went through the gambit of reasons not to do it, I felt like. And I'm in completely grief, my husband too. We both just wanted to be left alone with our son. And we were not thinking, like of the future. We weren't thinking about the next baby. We weren't, there was all this sadness around our son dying. And so we just made the decision that we felt kind of guided towards. So how do you encourage other providers to have this more respectful conversation that should happen and make it, where, obviously it has to be up to the parent and we have to respect. There might be a cultural reason, religious reason, whatever, that you don't want a full autopsy, but there are other options too. So how would you encourage providers to have conversations? These are difficult and we understand, maybe you feel like caught off guard and it was like, not what you expected to be delivering either, but here it is, so you want to help this family figure out what happened and help yourself too, to do better for your next patients. I just feel like there's so much information that can be gained in this period and it's the only time we can do it. So what would you say to those providers?
Yeah, I think we need to offer it more than once. Because in the heat of the moment, when you've just experienced that loss, like you said, you just want to be left alone. It just doesn't even feel like something you could comprehend, most likely in that moment. So I think revisiting it before discharge could be helpful. And I think, I don't know, maybe some OBGYNs might have a bias of like, well, what if something is found and it's going to be pinned back to me? Like, I don't know that that's really the case, but maybe there's some of that kind of thinking there. I've had patients say, I didn't want the autopsy because I didn't want to find out that there was something I did wrong and then blame myself.
Right.
And I think it's pretty rare that we find something like that on an autopsy. But there is, a good percentage. I think one study was like 74% of autopsies find at least some useful information. And if we don't even have that option, it's just, there's so much more we could be getting out of it. Mm-hmm. And I think a lot of times, revisiting the autopsy could also be done with a debrief, which I think is also really important for patients that have had a loss, after some time and before discharge, or maybe even after in some cases, meeting back with the provider, having a chance to ask all your questions, really getting a good description of what happened. Because what I find is a lot of women tell themselves really painful stories about what happened with their loss. And a lot of the time they're not even true. And it's just, how they've made sense out of it. And that debrief can be so helpful in preventing some, further trauma in how we think about things.
That's so true. And I feel like I definitely remember feeling that way because we didn't get a cause to right away. So it made me carry guilt that I did not need to carry, because clearly with the research that we've done at PUSH, there's just very, very few causes of stillbirth that were parent related, barring you did drugs and smoked and, did a, complete not taking care of yourself. But the most of the people that we know that had a stillbirth, they were like perfect parents, they're doing everything they're supposed to be doing. This is my second pregnancy. So I was following along what my doctors told me to do. Everything was great. Every appointment was great. It was just so shocking when it finally happened to us because we're just like, what did we do wrong? Like what could we do next time? There were so many things that were in our head after that, especially not having this information. And we'll just share here on the screen too. We have our page, which is pushpregnancy.org/loss. Lots of resources there for anyone who is investigating their loss, including what worked for me, which, not everyone will go this route, but I had a placenta pathologist do some research later. That was really all I had left because unfortunately, we buried our son. We had no information from the doctors. Again, no autopsy. So we were just kind of left with nothing. And after, many years of being an advocate, I started to learn of other options of things that can be researched. And one of the things is the placenta, which is, so full of information after the loss. So it has actually kept at your hospital for many years. If you've experienced the stillbirth, they might still have yours there. And it's in slides. So the pathologist from Yale took those slides, did his research, and within that same week, I had information. I actually was so shocked because it was in my junk mail, and I was like, wait, what? He already sent it? And, I'm like, oh, I gotta review this. And it was so stressful, but I put myself through it because I was like, if I'm going to tell other moms to do this, I have to do it. And, the parents that do it, they do have the same worries that I did. It was like, oh, what if this comes up with something that I did wrong in the last week or whatever, somehow, like comes to, the information that came out of it was the cord had issues. And it was something that neither I, and he doesn't believe the doctors, but I do believe because the cord was actually half the length it should have been. And that shows in my medical records from the delivery. But it got compressed, it got hypercoiled, which is kind of like a hair dryer gets kinked up, and then just didn't pass through enough oxygen and everything for my son in the last few days. So there was a change of movement. So we do definitely educate on that as far as what can you do for prevention. If you kick count, it's very important you do this regularly. So I'm going to put my quick plug for Count the Kicks, which is a program that we definitely support at Push, and I myself as their Latina ambassador. But you can kick count as soon as 28 weeks. That's when you have that pattern and get to know your baby's movement. And it does give you the opportunity to get there and get, evaluation from your doctor, which is going to have to be a little more than just check the heartbeat, because the heartbeat will be there until it's not. So don't do that Doppler check at home. Don't try to reassure yourself. Just get right there and get your doctor to check you out. So that was just a quick plug for prevention because that's our goal here. But let's move along to the topic of the pregnancy after loss and how you use information you've gathered now. You've done whatever you need to do to really try to get a cause for previous loss. And how does that help you to provide better care now for the parent after loss?
Yeah, I think, first of all, the information can just be so clarifying, right? Like you just described with the placental pathology, really giving you an idea of what happened and what went wrong. And so I think pathologists like Dr. Kilman at Yale, and there's, I think, another doctor who does that at Harvard, Mass Gen, Dr. Drusilla Roberts, can be so helpful because your community hospital pathologists may not be specifically trained in perinatal pathology. And so to have an expert review your slides is a great idea. I think what I love about maternal fetal medicine is I had an attending describe to me once, we're like the detectives of medicine, right? We're really going into what's your family history? What are your environmental exposures? What's any health problem you've ever had in your entire life? Because we know there are certain things that can really affect pregnancy and may not affect you when you're not pregnant. And so really getting to the bottom of somebody's complete health history, and then things that they can do to improve their health. And some of that is, I think there's a lot of people should just eat better and lose weight and, live a better lifestyle. And it's not that it's not true that weight affects pregnancy loss. It can, but I think we have to be very careful about how we talk to that, because blaming weight as the only thing, first of all, can miss so many other problems. And people can have metabolic problems and have a normal BMI. So we don't want to miss that either. So I like to focus on doable, healthy habits that you can do, right? And that can get you closer to your health goals. And And then really making sure you have the emotional support you need, going over just basic grounding techniques to get out of anxiety, maybe seeing a perinatal counselor or a therapist can be so helpful in some cases. And especially even, with complex PTSD, which a lot of women can have after pregnancy loss, seeing a therapist that specializes in some sort of trauma therapy method like EMDR can also be helpful. So just making sure that patients understand all their options. We know that mental health issues are a big issue in pregnancy and undertreated often. So mental health support is really important, and just making sure people have the resources they need as well.
Absolutely. And I will say most of the time for me during my pregnancy after loss, I didn't want to hear from anyone who hadn't had a loss as far as parents go, and, other mom groups, like that just didn't work for me anymore. I just didn't want to be around. It's too much positivity for someone who unfortunately saw a loss at the last trimester. And it was like, I don't have that moment of I feel relief. I'm past a certain week, because it was fear the whole entire way through, like miscarriage stage. Okay, I'm terrified. Okay, now I'm past that. I'm not with you where you're like, oh, I'm done. I'm not worried anymore. I didn't have miscarriage. So, of course, everyone expects to go all the way through, but I didn't anymore. So it was super hard. And then, of course, I had a high risk pregnancy, ended up on bed rest, 17 weeks, after the cerclage and everything. So it was just crazy. I'm like, why is this so hard? Like the whole thing was horrible. But I tried, positivity and all this stuff because I'm like, I want my baby to feel the good vibes. I want my baby to know he's welcome. Like, this is a good womb to stay in. I just was reading all kinds of stuff, and like crocheting as I'm laying there, trying not to go crazy because I couldn't move. But one thing that did definitely help me was the support groups that were for parents pregnant after loss, and kind of being with a cohort of other women who were like, okay, we're about the same amount pregnant. So we're all just like pulling each other through with, well, we did it today, or today felt good. Today I didn't cry as much, whatever we could do to just pump each other up, like, send each other little messages and everything. So I would recommend that for sure for anyone pregnant after loss, especially, if you don't have anyone in your life. Like I did this as a virtual group, so it was nice. I could just log in whenever we did a Zoom and just chat with these women that were going through it, and then message someone. I had a friend actually in Australia who was along with me. We were right along the same, amount of weeks that we just kept up with each other and messaged each other until the final, oh, our babies are here. And it was just amazing when they were here. But, it's never a given. It's even for a parent pregnant after loss, because you can experience multiple losses. And, I had a miscarriage, then the stillbirth, then a miscarriage. So it was just like a grueling 6 years of life of being pregnant, not pregnant, losing the baby, finally, being able to hold a living child at the end. That was still not expected, even, that time, so many losses. So it was hard for me to ever bring that optimism that I really wanted to bring into this. But I do think the provider can definitely help make that better. And we did have a high risk doctor as well, who was MFM. So he did understand, having seen all kinds of complications and seeing us through one of our miscarriages too. So he was very comforting and just saying, he's with us. Like one time I remember he said, I know you're worried, but guess who wants this baby here almost as much as you do? I'm doing everything I can in my power. And we need that reassurance and that, personal touch of a doctor really seeing you and understanding, like, you can't just be like all their other patients. So that's why with Push too, we offer a training now. It's at our website, push pregnancy.thinkific.com, for pregnancy after loss trauma-informed care. So if you're a provider, we ask you to take a look at that and consider taking it self-paced. And it includes a lot of stories from parents like us and lived experiences. We also have a lot of research in there. And this is actually what was used for the first rainbow clinics in the US that came up. So we have Mount Sinai staff that were fully trained with this to begin with. And then another university after that, hospital. So it's continuously being used, by different doctors, Dr. Rad's office as well in LA. So if your provider isn't trained in this way and you feel like they could use it, maybe you might want to share the link too, because they can definitely learn from it and maybe give you a little bit better care if you can't find a specific doctor in your area who says that, they're informed on this. We are definitely trying to keep spreading it wherever we can, but as of now, there's only a few rainbow clinics in the US. Dr. Kiesel, who's the originator of this idea and does all the research on the rainbow clinics, he is working on expanding it now throughout the United States, and we're going to be a part of that with our training. So definitely, look for them to grow, but in the meanwhile, your doctor can get this training. So with your patients, have you seen any differences in like how you treat them now, or do you treat them all as if they're basically high risk and they're basically, you're looking at their emotional side of things, because that's kind of what we're hoping is once people take this type of training and to kind of get their mindset like readjusted, like, okay, this is an individual case and not everyone is guaranteed the baby. Maybe it will improve protocol and care overall for all their patients, because you're not going to just bounce back to like the low risk model, I guess is what I'm saying.
Yeah, I think once you've had a pregnancy loss, maybe one early miscarriage we don't necessarily consider high risk, but more than 2 miscarriages or one later pregnancy loss, would always treat that as high risk. And I always tell patients it's not like I necessarily think something terrible is going to happen in this pregnancy at all, but I would rather that we just watch you closely, right, and make sure that you have the chance at the best outcome possible.
Yeah, there was a doctor that one of our lost mothers saw for her next pregnancy, and he was very sweet and everything, and his explanation to her really resonates with me. And he said we have to treat every baby like a life to lose. And, we have 2 lives on the line, if not more, so the mother as well. So there's interconnection. Obviously, if high risk stillbirth situation can put the mother's life at risk as well. So we have to be very careful in how we provide care and make sure that it is individualized and we're not just making assumptions, like in my case where it's like, well, your last one was perfect and this one should be the same. Your weight's normal, your baby's growing normal, but they just disregard the whole cord and placenta, which is giving your baby life. And we're just like, wait, what happened? How did you not look at it once? So yeah, that's to me very upsetting. I'll say that.
Yeah, I think
look at it that way.
I think, a lot of the issue with looking at the cord and the placenta is, been told like the data is not conclusive about a lot of this, right? So, I think the thought a lot of the time is we don't want to do too much intervention without a really good reason, because then we can cause, iatrogenic problems, physician-led problems where maybe there weren't any. But at the same time, there's no going back from a stillbirth.
Yeah.
And if the patient is, willing to do more monitoring, then I think in certain cases that can be really useful.
Mm-hmm. Yeah, and then the sad thing
we also need more research so that we can figure out more
what
those cases
please
are.
Help us do more research. With our friends that measure the placenta, they're trying to do research right now on the EPV studies that is estimated placenta volume that Dr. Kleiman has been trying to do for ACOG to then give approval, the Association of All the OBs, to say, okay, there's enough evidence to say we should be doing this. Of course, our argument as parents is like, well, you can just have this information because it's a simple measurement that can be done on any ultrasound, and use it as a tool to just kind of guide you and say, well, okay, we're going to keep a little closer watch on this patient. She's no longer really low risk because we're seeing this placenta is dropping off and it's not growing. And we want to make sure that that baby's getting nutrients. And, maybe you change the care plan and that's a situation. But I think doctors are worried. They're like, what does it mean? What do I do with it? I'm going to just pull the baby out because it's small. Well, not necessarily, but you can at some point if you do see the baby struggling and not growing, as they should. It's just one more thing to look at. My son's actually had a large placenta with a small, short cord. And I'm like, those 2 things alone could have been like a little trigger to be like, let's put her on a more high risk monitoring. And who knows, he could be here today. So I do believe in this push push the standard of care a little bit harder, and let's try to save some babies that can be saved, on top of the kid counting information that we share, which is 1/4 of babies can be saved with that, because that gives the parent enough time to come in and get those extra checks. And we have seen lots of babies saved from just that alone. But I want people to not have to rush till the last minute and have the doctors be the one to be flagging things, and tell them, we might be a little more high risk now. So let's go ahead and keep you here if we need to, or whatever extra monitoring needs to be done, or early delivery. So we can save some of these babies from the stillbirths that are preventable. So let's just close up today, because I know we were going to try to keep it short so this can be shared. Please share it with any of your friends and families that you know that are experiencing either pregnancy after loss or stillbirth. Make sure that they see this and can use this information for their care. And let's go ahead and close today with just asking you to share about your practice, because I want you to be able to reach families. What made you come up with this model of like a telemedicine? Is that exactly the right way to phrase it that you do?
Yeah. Well, to be frankly honest, I wanted to do something fairly quickly. I left my hospital job a little less than a year ago, and I wanted to be able to offer preconception counseling, because I know it's so hard for people to get in for that, because usually at a busy MFM office, it's just you're prioritizing the pregnant patient, so it's hard to get a consult in for preconception care, and I think it's so important. So I was like, well, this is something that's easily doable that I can start right now. So that was how that came about. And then I really wanted to focus on more support for women planning pregnancy after loss. So I have that membership, Building Hope After Loss, and we have a monthly live call, WhatsApp chat, and that will get started actually this week. So I'm excited about that.
Awesome. So I put up her website, so please check it out if you're interested. Dr. Emmie Strassberg.org or .com. And we'll definitely put the links as well when we post these lives. So if anyone has any questions, I am seeing some people are here watching live, but feel free to add them to the lives once they're posted. They're on LinkedIn, Facebook, and YouTube, and we'll be keeping an eye out for those questions. So Emmie or ourselves here can answer your questions regarding pregnancy after loss or stillbirth, and that way we can help you out. You're not alone. Just please know that that is, I think, the hardest part about these two experiences. To be honest, with my own stillbirth, I felt like a black sheep of like the whole community, because I was the only person I knew that ever had a loss this late. And I was, not knowing why, I was just like, oh my God, I'm bad luck. I couldn't even talk to pregnant people after that. I still have a hard time, because I'm like, I don't want to jinx anyone, which is a weird thing to feel like, but we feel that way. So just know if you've had a loss, it's not your fault. There really isn't anything that you would have done. I know you would have done everything you could to save your baby if you knew what that was. And, your provider too, I feel like they carry a lot of grief as well after something like this happens. And it's shocking. They're following their guidelines. They're doing what they think is the level of care you should have, but that's why we are just continuously pushing that, because of course something is being missed, and it shouldn't be. This many babies, 21,000 a year, should not be dying, and it shouldn't be the same every year. We can do better as a country. So please support PUSH. If you have any questions, again, add them to our chats, and we'll be happy to get back to you as soon as we can. We're all volunteers here at PUSH. We welcome you to also join us in this fight and preventable stillbirth. So if you want to become a change maker, you can always go to our website, pushpregnancy.org, and go to the contact page and let us know who you are and how you'd like to support the movement in any way. You can always just amplify the information and share our posts and share this live as well, so that other people can see and learn the facts that we've come to know after our losses. So you want to leave us with any closing thoughts, Emmie, for the parents going through this?
Yeah, I just, and to you too, Anna, I'm so sorry that you went through that. And of course, it's not your fault. Yeah. And I don't think we say that enough.
Yeah. And I mean, the parents after loss too, we just want to say, hang in there. It is a difficult journey, but again, if you find some good resources, either use Emmie as your support or find yourself a good group. I'll put a plug for Griffin Cares as well. It's a nonprofit that does a lot of good support groups virtually. They have one specifically for parents after loss. So You don't have to talk to the normal mom friends that don't get it. You can talk to people who understand you and feel that support throughout this process.
Definitely, community can be really, really important for that.
It is so important. Thank you so much, Emmie. We appreciate your time. Thank you guys for tuning in today. We'll see you at the next live. Bye.